everybody. Welcome to Overnight People and other tired residents. My name's Brian, and I'm going to be talking about mammalian bites. I figured for environmental trauma, I'd talk about something that we'll see regardless of our practice setting. So let's start off with a case, right? So I just want you guys to think about this case as we go through the rest of this presentation. It's a young male who got bit on the hand a few hours ago, and this is his dominant hand. Right? So just kind of think about how you would approach this case, what you would do to manage it, a very common thing to see in the emergency department. So as far as the goals for this presentation, I want to talk a little bit about the epidemiology of bites, and then I want to go through the assessment, what you want to look for when you're assessing these bites, then a little bit of the management of dog and cat and human and other mammal bites, and then talk about some of the current debates in the literature about how we should manage these injuries. Cool. So let's talk about the epidemiology. They're pretty common. There's like millions of dog bites a year. Not all of them present in the emergency room, obviously, right? The vast majority don't. However, there's a pretty significant admission rate. The high end of that admission rate comes mostly from these secondary presentations where people are like, 3 days ago I got bit by a dog and now my hand is red and puffy. Right? So that's where you get these high admission rates. As far as who gets bitten and where they're bitten, children are most often bitten by dogs. 93% of animal bites to children are done by dogs, and they mostly get bit in the face, right? Because they're short, so the dog bites them in the face. 63% of the time they get bit in the face. That makes sense. Humans bite males, kind of makes sense as well. And cats bite females. I'm just going to leave that as an example of maybe why that demographic is true for the epidemiology of bites. Researching crazy cat lady pictures is really funny. So, common bite sources. What do you guys think is the most common source of an animal bite? So humans are dogs. Yeah. So dogs are the most common. This represents up to 3/4 of bites. There's about 28 fatalities per year in the U.S. and these are mostly in children and mostly from bites to the neck. Cats. So you look at this little guy and you're like, oh, he's so cute, and then it's like, bam! Right? Cat bites are twice the infection rate. Dog bites typically have about an 8% infection rate. Cat bites are more in the like 13 to 15% infection rate. And we talk about how they're most commonly bit females. And then you guys also mentioned humans, right? So the vast majority of these are to upper extremities and hands, and they're mostly in young males, okay? So let's talk about less common bite sources. What do you guys think? So raccoons, squirrels, or other kind of like rodents, rats, monkeys are a much less common source of bites that I won't really address that much. Hopefully we won't that much. Bats, there we go. All right, so we covered pretty much most of the like ferrets, or like there's a lot of people have pet ferrets, right? And the one thing that I want to point out with this is that the bat wounds are typically very, very small and subtle. So that's the major notable fact from like these other animal bites. And of course, we can't forget rabbits, right? Very, very dangerous animals, obviously, right? All right, so let's talk about location. Where do you guys think animal bites happen?
Extremities.
So extremities and hands, very common, right? You're trying to break up a dog fight or pet a cat, and it's just a cat and it bites you. What else? The face, yeah. So really when we talk about it, we see a lot of hand bites, and we see a lot of face bites. There's going to be some gnarly pictures, so I'll try to warn you guys. You also see a lot of extremity bites, right? What about types of bites?
Puncture.
Okay.
She's like a bulging crush.
Yeah, so crush or like superficial which appear to be superficial but can have a lot of damage underneath. Like super big bites. So puncture wounds, open wounds are like the vast majority. They have these kind of gashes that the animal bites, and then the person rips their hand or extremity away, or the animal pulls back, you get these gashes. You can also see these huge macerated wounds. These are the larger wounds. And then you have these that are kind of unclear, like is this a puncture wound or is it just a superficial wound? It's really hard to tell, okay? What additional history do you want to obtain? Do you know the animal?
Tetanus.
What's their tetanus status? Other basic things about them? Rabies, yeah. So is it a known animal? Can the animal be watched? Right? Was it a provoked bite? Like, were you just trying to play frisbee a little bit? Right? Are there any teeth missing from the animal? If you can examine that or not, right? Because then you have a really high suspicion for foreign bodies. And some basic things about that person's past medical history that would make them higher risk for infection or complications. Right? All right, so when we talk about the management, there's some basics, right? First, you want to make sure that this patient is stable, okay? The vast majority of bites are very minor injuries, but there are some dog attacks, mostly dogs, that are just really vicious and can be very dangerous and life-threatening. So that's the first thing you want to make sure is that you control hemorrhage and that kind of stuff. Irrigation is so key for these. So you really want to wash them out. You want to get an x-ray, make sure there's no foreign bodies. You want to explore, not invasively explore, but you actually want to explore to the base of the wound to see if there's any other structures that are damaged or to see how deep that wound goes. You should not openly explore puncture wounds. You don't need to extend a puncture wound to be able to explore it to its base. That's one of the important things I learned. Really, really clean these guys out. This is the biggest thing to prevent infections is irrigation. And then you also want to think about the different prophylaxes, tetanus, HIV, and hepatitis B in the case of a human bite, and then the rabies prophylaxis, right? So let's start off with the most basic form of management. Let's talk about that really, really bad bite. There's going to be a gnarly picture here. So these are the cases that obviously need to go to the operating room, right? This is a massive, like, deep tissue involved, tendon structures, arterial bleeding. These things are stabilize the patient, give them IV antibiotics, and get a surgeon involved. So from our standpoint in the emergency room, these are simpler cases. As is very common, the critical care cases are pretty simple, right? And then there's like the groin bites or bites to other areas that are just... I told you that there was going to be a gnarly picture. It's like those are just like the obviously needs to go to the OR right now, and you just like pray with the family at bedside. So, human bites. There's two major categories of human bites. There's these occlusional bites where all you see is the teeth mark. And these are deceivingly superficial, right? So they're still just as seeded with bacteria. If you don't antibiotics these, it's a 50-50 chance you're gonna get an infection. So that's really surprising. That was surprising to me that even just with a superficial human bite, it's a 50-50 chance you don't give them antibiotics of them getting infection. And also, there's a lot of damage to the subdermal tissues. So you can get vascular damage and musculoskeletal damage deep to these very easily because the jaws are really powerful. Right? And then there's the fight bites. This is about 8 to 10% of human bites. Let's talk a little bit more of that. They often have damage underneath. So between 2/3 and 3/4 of fight bites have damage to deep structures that needs surgical management. So the reason why this is because it's a clenched fist, it's hitting a face, right? So the concern is that there's this very superficial layer of skin and soft tissue above very important structures, being the joint capsule, the joint itself, the extensor tendons. And what happens is when you clench your fist and you hit someone, that gets violated, gets seeded with bacteria, and then you open your hand. And that's what this picture is trying to show, is that when you open your hand, that small defect gets tucked back in, and you essentially have seeded bacteria into a joint space and then close that joint space, right? So that's why these get infected so commonly, and that's why these are always treated surgically. okay? If someone tells you that this doesn't need to go to the operating room, it doesn't look like it's gonna get infected, tell them that, yeah, 25% of the time, maybe not. But the other 75% of the time, this is gonna turn out to be an infection, and if it's delayed treatment of that, it can have significant morbidity to that person's hand, especially if it's a dominant hand, right? So, a brief summary of what we've covered so far. We've covered human bites, right? So human bites get IV antibiotics and surgical treatment if they're to the hands. If they're to other areas, they get antibiotics no matter whether they're superficial or deep. And you can consider closing these wounds if they're to the extremities, or to the trunk and to the extremities, depending on how contaminated they are and how deep they are, okay? There's a lot of debate in the management of dog and cat bites. I'm going to cover that during the debate section. So briefly, before I move on from the management, I just wanted to talk about rabies. It's kind of just stuck in here because I didn't have a great place to put it. You guys know about rabies prophylaxis. Basically, if you can watch the animal, bats, you definitely give rabies prophylaxis. And pretty much every other animal in the United States, you don't have to give rabies prophylaxis for. It's a case-by-case basis. If you can watch the animal for 10 days, there's never been a case of rabies in the United States from an animal that was watched for 10 days. So that's good to know. It's good to reassure your patients about that, right? And if they're immunocompromised, then you do the 5-day regimen, but the 4-dose regimen is for pretty much everybody else, okay? I don't want to touch on that too much. So let's go back to our case, and I'll use this case to illustrate the debates about whether to close these wounds or keep them open, where they are, and whether to antibiotics these or not. Mostly I'm going to be talking about dog and cat bites, and most of the data comes from dogs. So let's talk about closure. All right? What do you guys think? Would you guys, let's say you have this wound.
I would maybe throw 1 or 2 sutures just to kind of protect the wound a little bit, because right now it's wide open.
Okay. So if it's like a gaping flap, you would consider loose approximation. So that's technically delayed primary closure, right? It's a version of delayed primary closure. You're not leaving it totally open, but you're definitely not definitively
After, like,
closing it.
obviously irrigating it.
Yeah, not just like spitting in the wound and throwing a few sutures, yeah.
Having a fight by them.
Yeah, exactly. Well, so first, after you get bit by a dog, you need to suck on the wound to make sure that you seed it with human bacteria too, just to really make sure that the mix is complete, right? So when I'm talking about closure, I'm not talking about this kind of closure, right? I'm talking about this kind of closure, right? So let's go into the data. You know me, I love to like go down these literature wormholes. So I went down a literature wormhole and I found a few good studies. So there's this. There's 3 randomized controlled trials. So this is one of them. There's 100-some patients. And you can already see that we're looking at 14 infections, and we're making grand conclusions based on that. So when we look at primary suturing and infection rate, you see that the infection rate was greater with primary suturing, but not that good, not that big. I don't know if you guys can see these numbers. There was 8 infections in the primary suturing group and 6 infections in the delayed closure.
And a p-value.
And a p-value of 0.5, right? So pretty equivalent. But this study was powered for cosmesis. The powering of this, whenever you look at whether a study was statistically significantly different, and you're looking at a difference that you see in the study, but it's not statistically significant, you always want to ask, well, were they powered to detect that difference? This was powered to detect the fact that primary suturing produces better cosmesis. All right, I knew that. You didn't have to do a study, a randomized controlled trial. So my question is whether there was a type 2 error in this study, which is where you perceive a difference, but it's not statistically significant because maybe you didn't have the power to detect that difference. I don't know. There's no great answer to that. So let's move on to the next study. This is another RCT, right? And, the same RCT, and I just wanted to point out the fact that all of these infections, or almost all of them, 10 out of the 14, were to the upper limb, okay? So when you're looking at whether you're thinking about closing this, the vast majority of infected wounds are in the upper limb, so you should be cautious about that. 12% versus 0% of the head and neck infections got head and neck wounds got infected. And then the other thing, when you look at timing from this study, they do a really nice job of breaking down whether these wounds presented early or presented late. And there's a major difference, a 4% infection rate if this wound presented before 8 hours, and a 22% infection rate if presented after 8 hours. So that can also, when you're dealing with something that's so nuanced, there's a lot of different management, you can use these things to help decide whether you're going to close or open this wound, right? If it's 24 hours out, I'm less likely to close that wound. And also, the other thing that I noticed is that there was a twofold increase in the infection rate when you primarily close these wounds, even if you close them before 8 hours. But that's the difference between 4 infections and 2 infections. It's hard to really make conclusions based on that. There's an older study. I love the way they presented the data in this. I copied the figure because it was so funny. Literally, they just were like, this is where the infections were on the little human person, right? And they also, so they included the same kind of thing. There's 100-some wounds. They were not given antibiotics. So that was an interesting thing about these closed wounds, and I'll talk about the antibiotics later. But hands represented the vast majority of these infections, right? Yeah?
I'm a little bit confused about how they're presenting this data. Are they saying that of all the infection totals, all the hands are 70%, or are they accounting for the fact that hands are the majority of the dog bites? You see what I'm saying? Is it really that, if you get bitten on the hand and bitten on the head, you're that much more likely to get bitten on an infection in the hand, or is it that you're more likely to get bitten on the hand, so they're more likely to get an infection in the hand?
So this 70% is an absolute number. However, even when you account for the fact that more bites are to the hand, there are still more infections.
That's right.
Does that make more sense? So if we go back to this guy, right? When you look at the upper limb, yes, it's absolutely the most infections, but it also percentage-wise, it is a greater percentage of infections, right? This 70% is an absolute, okay? I think as far as closing these, what you should look at is the figure, the red numbers that are on the figure to the right. So this is the percentage of wounds based on that anatomic location that got infected. So this is a relative infection rate, right? So relatively, 16% of the closed hand infections got infected versus 9%. So basically, by closing a hand wound, you doubled your infection rate. Again, this is based on a very small number of infections. Yeah?
And they didn't get antibiotics.
And they didn't get antibiotics, which is a big deal. Like, if I closed a hand wound, I would absolutely give this patient antibiotics, right? So there's some faults with these studies. I think one of the most powerful things that I took from this literature was this study. This was 600 facial bites from dogs, so a ton of data, right? This actually has the power to detect something. And when they closed facial bites, even when they didn't give them antibiotics, they showed a decreased infection rate. Okay? So to me, this is a really convincing argument to close facial wounds. You have improved cosmesis, you have shorter healing times, and you have actually a lower infection rate in a large randomized controlled trial. That to me is good enough evidence, right? There was a meta-analysis of all this data. My problem with this meta-analysis is that we already just talked about how heterogeneous the presentations and the different studies are. So concluding something from this meta-analysis about the fact that, oh, if you close dog bites, they don't get infected, that's not taking into account where the dog bite was, whether you gave antibiotics, the timing of the dog bite, and those three things I think are really, really important. So, also it started with like, dear sir, which is a really funny. So risk factors, there's 2 studies. They're both these large prospective trials by Dyer, and they basically showed very similar risks for infection, kind of the things we already talked about, right? So what we didn't mention is if this patient is older, so we talked about the comorbidities. But if the bites themselves are older, or if they're deeper wounds, full thickness, things like that, okay?
Are those studies also from like 80s and 90s?
Yeah, most of this one's from 91. I think this one's from even earlier. Most of this literature is old. Most of it is from like 80s, 90s. Some of it is early 2000s. Most of the stuff in the 2000s is review papers that are going back and like making grand conclusions based on the data that I just presented. That's why I didn't want to give you the conclusion that they came to, because when you look at the data, it doesn't support those conclusions, in my opinion. So let's talk about primary closure of dog bites, just to summarize what we talked about, right? So all of these studies excluded these patients. So in my opinion, unless it's a facial wound, you should not close a dog bite if the patient is immunocompromised or has other high risk for infection. Right? I would leave hand wounds open. Loose approximation I put down here is a question mark. There's no data on loose approximation, nobody talks about that, but technically it's a delayed closure, so I think that's still reasonable as far as like open. And I think it would be reasonable, especially in the hand where functionality is going to be so important, to loosely approximate. And actually in the case that I showed you guys with the large gashed dog bite, I did loosely approximate that, and the patient did really well. After copious irrigation and dose of IV antibiotics and really close follow-up, right? And I think this 8-hour time mark is a really good benchmark for our assessment of the risk about whether we're going to close that or not. Okay? Just to give you guys some other pieces of data to work with when you're deciding to close a bite or not. Briefly, cat bite closures. There's not a lot of data on this, so I'm very hesitant to be like, oh, there was 8 cat bites and you closed them and they didn't get infected. I don't know if I'm going to manage all of my cat bites for the rest of my career based on that data. And these two, the 4.4 infection rate, those are both on the upper extremity. So if you were even going to consider closing a cat bite, which are mostly puncture bites because of the fangs, I would never close an upper extremity cat bite. The only place I would really close a cat bite is the face, again, because there's just such good data that the face doesn't get that infected. Just to show you guys, these are the size sutures you would use if you wanted to primarily close, and this is the timing of removal, so it goes from smaller sutures in the face and larger sutures in the extremities, and longer times as you get to higher stresses. You guys know this stuff. Antibiotics. What do you guys think? They also have a cold, so why not? Yes, no. What about this hand bite? Would you give antibiotics to this hand bite? All right, so we're all kind of like, yeah, absolutely. What about a small 1 centimeter bite to the leg? Yep.
I have read a study, I think it was somewhat recent, maybe 2011. It was a small, I think it was a small RCT that did say, you know, they examined, they controlled antibiotics and no antibiotics with like aggressive irrigation and things like that. I think they found that basically it was equivalent. You know, whether or not antibiotics were there. In dog, this was a dog bite.
In dog bites.
So.
Did they specify where? Do you remember?
Including the hand. Yeah, I think it definitely included the hand. I don't remember.
You might be thinking about this Cochrane review.
No, it was.
This Cochrane review is from 2011.
Oh, no, it wasn't a Cochrane, but anyway.
The thing that I love about this is 2007 actually. So this is published in 2007, and all the studies are from the 80s and 90s.
I think my point was I think there is some data suggesting you don't have to antibiotics.
You don't have to antibiotics them unless there are certain cases, right? So that's what I wanted to go through, is like when you would even consider not antibioticing these, right? So the first thing that the Cochrane review said is that in human bites, you should absolutely antibiotics these patients, right? What I love is that it's a meta-analysis based on one study of 45 patients. Right? Granted, I think there's enough convincing evidence in the other areas of the literature to show that you should antibiotics these. There's like small retrospective trials showing this like, 0% infection rate versus 50% infection rate, stuff like that, right? So I think there's enough of a benefit shown in other small trials that they didn't include here. The other thing that the Cochrane review said that across the board for dog and cat bites, you don't need antibiotics, right? What do you guys? Are you guys familiar with reading meta-analysis charts? Yes? No? Hopefully. So when you look at meta-analysis charts, there's the line that's in the center, and that's 1, right? So that's an odds ratio or relative risk of 1, which means that if you're to the right of the line, there's a statistically significant benefit to doing that intervention. And if you're to the left, there's a significantly significant benefit to not doing that intervention. Or if you're like antibiotics would be this way, and not giving antibiotics is this way, okay? And the important part is not necessarily where your dot lies, but where the confidence interval is, right? So the confidence interval, as that confidence interval moves past the line, then you start finding a statistically significant difference. So in this case, our confidence interval is to the left of the line. So we're saying that there's a statistically significant difference, and you can see the p-value is 0.02, right? So when we look at this, first of all, we look at dogs at the top and cats at the bottom, right? So dogs, there's just a lot of like equivocal data, right? But I showed you guys earlier that there's a lot of heterogeneity across this, so it doesn't really make sense for us, for me at least, after looking at all of these studies individually, to make conclusions based on that data. To like lump it all together and be like, oh, no antibiotics for everybody. And for cats, this is the study that I talked about closing cat bites. Remember those 8 bites that got closed? That's this. There's 11 patients in this study, and they're making conclusions based on that. To me, that's just not enough. Okay? And even in that tiny sample, they almost reached significance to give cat bites antibiotics. It was very close. So to me, I would give antibiotics to cat bites. How about puncture wounds? They were like, there's no benefit for puncture wounds. Again, in this Cochrane review, they combined dogs and cats. To me, this is problematic because cat puncture wounds are significantly more likely to be infected. We've shown that in the epidemiologic data. So when we look at this, they combine them and they say, oh, it averages out. But really, when you look at cats, it's that same Ellenblas study from 1984 that showed maybe these cat puncture wounds need antibiotics. All right. So the one thing that they showed unequivocally is something that I've emphasized before, is that hand bites get antibiotics and get left open. Okay? This doesn't address the openness, but I just wanted to rehash that. So a nice set of 3 studies that were relatively small themselves, but still there's a very consistent message that hand bites should get antibiotics, but the number needed to treat of 4, which is pretty good in our world of medicine, right? Cool. This was the same meta-analysis done on the dog and on dog wounds alone, so they removed the cat wounds. So this is the same picture as this top graph, but just done in a statistically different way, and they found a significant difference. So to me, this is just like, this data is just useless for our use, because if you do the meta-analysis in 2 different statistical ways, you get 2 different conclusions. There's not enough for me to make a conclusion based on it. If you're gonna give them antibiotics, your first line is Augmentin, right? I put it up there. So your first line is Augmentin. If you think for some reason that patient's not gonna be compliant, you can give them a shot of IM penicillin. If they're penicillin allergic, you wanna give them Flagyl plus Doxy, Cipro, or Bactrim. Okay? And we kind of already talked about the indications outside of the type of bite and the location of the bite to give people antibiotics. So, in summary, there's not great data, right? We talked about the fact that there's not great data. You really, really, really want to irrigate these wounds. The risk for infection is greatest in human bites, then in cat bites, then in dog bites. And you leave your hand wounds open, you close your facial wounds, and then you assess the risk of other wounds based on the other features, right? I've given you a set of tools to assess whether this wound on the extremity of the trunk needs to be closed based on its timing, based on its depth, and if you close something, I would use antibiotics based on my data that I looked through. So to summarize that, I have this, and I'll take any questions you guys have. These are all my references.
Only 2 questions after Dr. Silver.
All right.